doctors to the barrios in the Philippines, assigned in the municipality of San Juan, which we'll be talking about this afternoon. So let's talk about e-Sakto. E-Sakto, the lowering of the cardiovascular risk of patients with hypertension and diabetes through public and private partnerships. As a background, in the world, the top 10 cause of mortality remains to be coronary artery disease, and this has been so for the past few decades. In our region in Southeast Asia, by 2030, it's expected to claim 2.5 million lives of our people in Southeast Asia. And what is coronary artery disease? So coronary artery disease mainly is disease in the heart where the big vessels supporting our heart or the coronary arteries are blocked. And these are blocked because of what we call cholesterol plaques as well as inflammation. When the blockage is small, but yet uh, it causes blockage in the bloodstream, so it may cause chest pain. And when there is a complete blockage, we call that a heart attack, and part of the heart dies. This is precipitated also with smoking, hypertension, hypercholesterolemia, diabetes mellitus, and a sedentary lifestyle. Sustained hypertension is a major risk, especially when it's combined with diabetes, which is the number 8 cause of mortality in the world. The World Health Assembly has already created a threefold strategy to combat this and other non-communicable diseases and emphasizes on surveillance. The WHO created the model called the Universal Healthcare Model, and it has 6 pillars of health. Here we emphasize surveillance for health information, and the other pillars include governance, health financing, service delivery, policy and strategy, as well as health human resource. The ASEAN countries have done good progress towards the UHC. However, there's an existing data gap in the ASEAN coverage of services related to the non-communicable diseases, and this is what we try to address in this study. In the Philippines, we have our Philippine Health Agenda, the IRCHE, with 3 guarantees of a service delivery network that's functioning, doing programs for all life stages and triple burden of disease, as well as universal healthcare coverage. In terms of triple burden of disease, we will focus on the non-communicable diseases, like diabetes and heart disease in this study. And yet, we still consider the factors of complying with the clinical practice guidelines, availability 24/7 of these services, practicing gatekeeping, health access located towards and close to the people, and enhanced by telemedicine. So what's really the problem? There's a lot of problems actually in the health system. So as doctors, we have red flags within the 6 pillars of health. And where we come from in the Central Visayas, the problem is that the information does not actually reflect national data. Why is this so? When I went to Sambuan in 2015, I found out that there was no health information system to be had. So all the red flags are here in the 6 pillars of health. There was really poor service delivery because of all of this, including in a health information system that's not exists. So there's improper vital signs, no recording and monitoring of the patients. So we wanted to leapfrog from having this into having patients come into the IRCHE or the rural health units and being given proper care. We also wanted to leapfrog from paper-based system into an electronic medical record that's available 24/7 online or offline. This is the conceptual framework for e-Sakto. So the present conditions included the health workers' competencies were not checked, as well as the lack of individual medical records. There's poor patient care, and down the line, medication errors, no health reports given, and no health referrals. With e-Sakto, and the intervening economic conditions of provision of software and the infrastructures with the laptops, as well as the buy-in of the stakeholders, the local officials. We hope to validate their competencies of the healthcare workers, launch the EMR, evaluate the lowering of the hypertensive subjects, BPs, as well as link them with higher health institutions. We hope, in essence, to increase client satisfaction and responsiveness and improve the health status of the community. Essentially, what we wanted to do was to standardize competencies among the healthcare workers and the volunteers and improve the health information system with the presence of the electronic medical records, as well as increase the efficiency of care for patients. In fact, we wanted to see if what we do really lowered the CVD risk of these patients, and do timely submission of health reports and ease of the two-way referral for health. The objective is to undergo a technologically enabled whole of society approach in upgrading a rural health unit in terms of data collection and records management, and determine the 10-year cardiovascular risk score of patients with hypertension, with or without diabetes. So, just a quick question: would you know someone with hypertension and diabetes in the family? Yes? Can you raise your hand if you know someone? Yes? So this will be useful for the family, not just for Filipinos, but for all of us Asians. The promise is that nobody can has the ability to make things perfect, but we can make things right. In the Visayan language, we call that e-Sakto. So that's where we coined the word, the e-Sakto. It has four components: e-Sakto sukod, e-Sakto suwat, e-Sakto sibya, and e-Sakto serbisyo, which means the right measurements, the right recording, the right information, and the right service. This is a descriptive study using the Shine OS electronic medical records, and this is the interface. And we got this free electronic medical record through a public and private partnership with Smart Communications, which provides cell phone and internet services in the Philippines. So first, ethical considerations. In the Philippines, data privacy is not really a big thing. But in this study, we created the first data privacy protocol for municipal offices, and this is the first in the Philippines, to ensure that the medical information stays private. So as I've mentioned, Sambuan is located in the southern tip of Cebu in the Philippines, and it takes us 4 hours to get from Sambuan to the city. So Sambuan is also known as the waterfalls capital of Cebu. Anyone here has been to Cebu? No? Yes? Oslo, the whale shark? No, not yet, but it's just an hour away from the whale shark. So Sambuan is a fifth class municipality with 20,000 people. So these are the facilities that we have. It's really a little town with birthing facilities, a TB dogs facility, as well as an outpatient facility. I am the only doctor in the whole town, and I have a team. Thankfully, I have a team of nurses and midwives who help me out in this town, as well as some barangay health workers or the health volunteers. For patients, we chose 106 out of the 414 hypertensive patients that we had in the town, and they underwent 3 monitoring visits starting November 2015. People who were included were adult patients with BPs 140 over 90 and above, and with 2 recent primary care visits, as well as those patients taking antihypertensive medications. So patients who had really greater comorbidities were not included. So let's go through the 4 components. So for right measurements or e-Sakto sukod, we standardized the competency check for health staff. We did an inventory of tools for the measurement of the vital signs, and this is our nurse, our health volunteers, and they're doing a competency check. And they were made treatment partners for our patients for measurements, for monitoring. We institutionalized the use of Shine OS with partnering with a school, a local school, it's Wu Technological University, and we tapped their IT students to encode the records into the system. So I underwent several trainings as well as two of my staff went through continued medical education in diabetes and hypertension for e-Sakto information. Consequently, what we did was to make community health clubs for all the 15 barangays in Sambuan, and this was the venue where we did the patient monitoring as well as community lectures for patients who were high risk for these diseases. We also used the WHO ISH for the Western Pacific region risk prediction chart. So, as you can see here, it's considering age, whether the patients were male and female, non-smokers or smokers, and people with diabetes or non-diabetics. So if you notice, people with diabetes already have red flags here. And these are the risk levels that we use. So there is a 3-point scale, either mild, that's green, orange, moderate, or high, red. The risk we're talking about here is the 10-year risk of whether a patient will have a heart attack or a stroke because of their condition. And there's also a 5-point scale, which is more stringent, which is more specific. What we found out is that with the competency check, thankfully all our health staff knew what they were talking about and knew how to take BPs. However, 41% of our volunteers didn't know how to properly take vital signs. In Singapore, they already use electronic BPs to measure all the vital signs. However, in the Philippines, we're very dependent on our health human resource. And what we did was to retrain our volunteers and staff. In the inventory, we found out that only 4 out of the 15 barangays had adequate equipment, and so we bought some for them. We launched Shine OS officially, and Smart trained our staff. And we were very happy that the IT students in 2 weeks were able to encode 5,000 of our records. And this enabled Sambuan IRCHE to leapfrog from having no health recording system to having an advanced and fully functional system that's available online. So to continue on, we expanded the service delivery network of Sambuan by partnering with higher health institutions and with Vicente Soto Memorial Medical Center and Cebu Neuroscience Society for two-way referrals. And we also spoke with the other mayors in the municipalities for them to also sign with Smart Shine OS to adapt this system in their municipalities. We also presented this to the hospitals in the region 7, as well as to all the municipal health officers in the Philippines during the AMHOC Annual Convention in 2016. Going back to Sambuan, so the monthly community health clubs had around 40 people in them each month, so 40 times 50. And the attendance was encouraged because we were giving them free medications. And we were monitoring their BPs, and we also gave free diagnostic or laboratory tests such as the random blood sugar at different times. The RHU also screened all the people above 25. So the mean age of the patients were at 59, mostly female, similar subject profile to a study in Nepal by Kanal et al. And among the subjects, 8 had hypertension and diabetes, and 4 were smokers. And they were taking antihypertensive meds. So using the WPRB chart, we found out that the initial risk of Filipinos were mostly mild to moderate risk. And e-Sakto went a little bit further than this Nepalese study, in that it monitored the subject's level at 3 to 6 months after. So, lastly, we found out that both 3 to 5 point scoring lowered the 10-year CVD risk of patients, and this was statistically significant. The e-Sakto intervention with the use of the Sham-OS EMR may lower the incidence of heart attacks or fatal cardiovascular events. So thank you very much. That is the conclusion of my segment.